Hi everyone, my name's Damon, and today I'll be presenting on part of my doctoral dissertation that explored patient and caregiver identified priorities for stroke care in northern British Columbia. So for everyone joining, I'd ask that you all take a moment to acknowledge the traditional territories of where you're coming from today. Before I begin, I'd like to acknowledge that I am joining you today from the unceded and traditional territory of the Lheidli-T'enneh, part of the Dakat First Nation. So it's well known that financial pressures and an overall strain on health system sustainability has placed a renewed focus on the need for health systems to evolve and respond to real-world challenges while delivering high-quality and evidence-based care. Engaging patients, or those with lived experience, has been proposed as one way to increase the relevance and responsiveness of research that can drive true health system transformation. So what I'm presenting on today is one phase, the qualitative component, of a multi-method, multi-phase research study that I undertook for my dissertation. The goal of this research was to better understand why or why not people may arrive by ambulance when experiencing stroke. To explore this, I undertook semi-structured qualitative interviews with stroke survivors and their caregivers who had stroke in the last 5 years and presented to and received care at any emergency department within Northern Health. The questions were co-developed with input from a patient partner who had lived experience of stroke and survivorship in Northern BC. This work was guided by an integrated knowledge translation lens, and research questions evolved after initial conversations with provincial stakeholders when discussing findings from a 2016 project that explored the optimization and implementation of clinical practice guidelines for stroke in Northern BC. And that work really laid bare some of the challenges with meeting current benchmarks of clinical care in smaller settings, such as those in Northern BC, including the complexities of health and human resource challenges. So this multi-method approach employed in this study not only provided quantitative findings, but qualitative interviews with stroke survivors and caregivers offered key contextual insights to complement that quantitative work and vice versa. So here's a brief timeline of the process. And the concept of this work, like I said earlier, really came from some work that was undertaken in 2016 by my supervisor, Dr. Davina Banner, which explored the challenges around implementing clinical practice guidelines for stroke in Northern BC. As part of this, stakeholders, including decision makers and patient and community representatives, were consulted around some of the challenges surrounding stroke care in the region. So as a result of this work, my plan then for my doctoral dissertation was to focus on decision-making around seeking emergency care for stroke. But my plan was narrow, and I quickly learned that for those with lived experience of stroke, it wasn't so discrete or black and white. Instead, there was a continuum, and this was reflected in the findings where participants not only spoke about seeking care and their decision-making process around that, but also their overall experiences with the health system in the process and areas that they felt were in need of further attention and support. So some of my insights from the experience really centered around questions that I had thought were important to ask based on in part my own understanding as well as a review of the literature were not always what mattered to those with lived experience. Challenges to engaging patient partners at the doctoral level because of time and funding constraints were also very apparent, as well as some challenges around patient partner compensation and funding mechanisms available to doctoral students. Overall, based on my own experience and my opinion, there is a need for a greater focus on providing trainees with opportunities to engage with those with lived experience early on in their training. This will provide a solid foundation for more meaningful engagement as trainees move into their independent research careers. But from my own experience, one of the things that I found helpful was the Foundations of Patient-Oriented Research workshop hosted by the BC Support Unit. So if there are any trainees on the call today, I highly recommend that. So just reflecting on some of my own learnings through the process, the key really to expect the unexpected and allow it to be a learning journey. Through my own experience, when developing some of the recruitment and information materials as well as questions, there were some differences between what those with lived experiences, including, the patient partner, identified as real needs or things to focus on, compared to what the research ethics boards required for approval. So an example would be in the information materials and recruitment posters, there was a real emphasis from the patient partner who stated that the materials needed to be, as bare minimum as possible, because having a stroke or brain injury really underlined, the need for very simple communication to prevent that kind of information overload. But from a research ethics board perspective, there was this, need for certain factors and points to be outlined in this material. You needed to check off all the boxes and make sure that you were, outlining all the policies and procedures that were required, which often led to a very long and lengthy information and consent form. And this was in contrast to what I was hearing from patient partner, simple versus complex. So there were some tensions there, but not unsolvable with some dialogue and communication and compromise. And I think just as a reflection, as researchers in training, we're often on our way to becoming experts. But I learned that the key, in this entire process is to be humble and open and receptive to feedback, because at the end of the day, those with lived experience are the real experts in this process. And so as researchers, just the need to sit back and listen and learn from all this. So some keys to success. A lot of this really boils down to relationship building. You need to start early, be flexible, and communicate regularly. Perhaps most importantly at the graduate level is to have supportive mentors that encourage this type of engagement and ways of working. For this project, early and sustained efforts to engage patients in a meaningful way provided a real solid foundation to understand the topic of interest, in this case, stroke care. And listening and learning from those with lived experience truly made the world of a difference. The data was much more rich, in-depth, and reflective of the real world. In turn, this led to more concrete and actionable research that can be used to improve care in this area. So for any supervisors or trainees attending today, I would say trainees are often discouraged from using an integrated knowledge translation approach to their work or engaging those with lived experience as partners in the research process. And there's good reason for that. Commonly cited concerns include significant time investment, the added workload, and the need for additional resources, either financial or training opportunities that are harder to come by at the trainee level. But I would say that it's important to not let that discourage you. It takes work, but it truly is a rewarding and transformative experience. in my own case, having a very supportive supervisor who embodied this way of working herself, as well as a supportive committee and stakeholders and a very engaged and passionate patient partner, made the world of a difference. Finally, I'll leave you with this quote from patient partner Barbara, who said this about her motivation to be involved in this work and why this was so important to her. She said, "I heard about this through your window, so I thought, okay, in 2 years, I'll just be in a different direction. And like God never wastes a hurt, this was mine. And that's why I also got involved with the stroke research, and that because I think it's so important our testimonies help each other." And on a final note, please don't hesitate to reach out if you'd like to learn more about this work or have any further questions. My contact information is noted in the bottom right-hand side of the screen. Thank you.